Daycare oncology is a very evolved concept where a lot of cancer care delivery happens not in the big hospitals, so as to say, but they happen in a small tertiary care units or a small daycare units. Not that India cannot innovate, we are doing a lot, and the IITs of the world and a lot of other small units and also the teaching hospitals are doing their bit. But I think in terms of innovation, we have still long way to go. It's a robotic surgery which is coming up. Then there is more precision in terms of the radiation delivery which is happening. So I think there are exciting times, and at the end of the day, it's the patients which have benefited, which is great to know.
Welcome to another episode of The Shift, powered by ET Edge Insights, a platform where we sit with thought leaders and experts to discuss key issues shaping the world we live in. And today we have with us Dr. Ashish Joshi, who is the director and co-founder at MOC India. Dr. Joshi, welcome to ET Edge Insights.
Thank you.
So, to start off with, Dr. Joshi, oncology is evolving with each passing day. Give us a pulse of how daycare oncology is evolving, particularly in areas that are short on resources.
So if you look at up global north, which we talk about the developed countries, daycare oncology is a very evolved concept where a lot of cancer care delivery happens not in the big hospitals, so as to say, but they happen in a small tertiary care units or a small daycare units, which is spread across geographies. Relatively, this concept is newer in India, but again, as a huge unmet need. As we all know, a lot of oncology treatment protocols have changed, and it's become more chronic reverberating treatment where patient has to come again and again, again and again, and it's been actually pushed into a chronic disease where the longevity has increased, and hence the number of visits to the cancer care provider has catapulted. And for us, for a patient at large and the caregivers to come and reach to a regional cancer institute or let's say a tertiary hospital may not be feasible. And hence a good level of standard of care needs to be provided. Hence this concept of daycare oncology, which kind of is now picking up. A lot of small daycare units like MOC are there. And now, of course, Government of India has taken an initiative to start daycare oncology in various district hospitals as well. So yes, there are currently still early days, but a lot of oncology can be delivered in a daycare setup, which is what we've learned in our journey.
Right. And given the importance of collaboration in any concentrated effort, what have been the key challenges, the main challenges in your experience, especially when it comes to collaboration in cancer research?
So collaboration and cancer research, there are two important key challenges. One is human resource, because as you know, the demand supply in terms of availability of oncologists and the demand is very skewed. So availability of good human resource who could deliver a standard of care oncology is a huge challenge, and that I think all of us are going to face with the burgeoning demand of cancer care. The supply is still not adequate. So that's one of the key challenges that we have, and very important to understand that the daycare centers cannot run without an oncologist. You need to have a captain. You need to have an oncologist who is captaining the daycare unit. Then only there is a substance to the unit, and then only the patient value chain is actually created and governed, so as to say. So human resource is very important. Second, in terms of capital, yes, a lot of innovations are happening in oncology abroad, in US, because it's a mature economy and a mature market, so as to say, in terms of the business parlance, in terms of innovation. Not that India cannot innovate, we are doing a lot, and the IITs of the world and a lot of other small units and also the teaching hospitals are doing their bit. But I think in terms of innovation, we have still long way to go. We are excellent in cancer care delivery provision, but we have still have something to catch up as far as innovation and research is concerned.
Right, right. There have been many trends, in cancer research. According to you, which are the most promising trends and trends that you look forward to the most?
So as you know, if you see the last 2-3 decades in oncology, whatever the research and innovations have happened are predominantly in the field of molecular oncology, cell biology, and medical oncology. That is the cancer medicine aspect of it, where we are trying to understand the cancer better and try to create an impact. Now, some of the key examples is the evolution of targeted therapies, which are far better and more specific for cancer treatment. Then there is an evolution of immunotherapies, which are using our own immunity to kill the cancer cells. Then there is evolution of a lot of cellular therapies, which is called as CAR T, etc. And massive expansion of genomic oncology and precision medicine. I think these are the some of the very key highlights in terms of the cancer innovation impacting patients. And this has happened over a period of last decade or so. These innovations are creating massive impact. Also, there are things which are happening in terms of surgical aspect. It's a robotic surgery which is coming up. Then there is more precision in terms of the radiation delivery which is happening. So I think there are exciting times, and at the end of the day, it's the patients which have benefited, which is great to know.
We've spoken a lot about the MOC model and the kind of improvisation it's gotten. Elaborate a bit about the MOC model and how it is balancing clinical outcomes as well as the patient's quality of life.
So again, MOC model is basically, in simplistically put it, it's made by doctors for patients, and that's the story ends. And when you have a monolithic vision of a patient improvement and patient care, then everything falls into place. So as we've mentioned, there is a huge unorganized sector of oncology which is delivered between the tertiary care hospitals and the research institutes. There are a lot of small nursing homes, private clinics, trust hospitals, and a lot of patients simply do not have an option. So MOC aims to revolutionize, regularize, and standardize this unorganized oncology sector by creating bespoke daycare services across various geographies. Again, it's not about just a daycare service, it's about having eminent oncologists with us who will deliver a standard of care. And good thing about oncology, it's very protocol driven. So of course there is a human interface which is required, but we've got oncologists of repute with us with a very, very strong non-clinical team which is governing all the corporate aspects of the cancer care delivery. And that's the heady cocktail that we are looking at, which makes the cancer care delivery very unique as far as MOC is concerned.
Right, right. Dr. Joshi, we are living in times where has begun to shape literally everything around us. Telemedicine has gradually played a important role. How do you see both artificial intelligence and telemedicine playing a strong definitive role in the future?
So I think acquiring technology is very, very important. To be very honest, medicine is always language behind. It's the last to acquire a technology. You will see other service providers, other facets of businesses acquire technology very fast. But AI is obviously going to create an impact. Machine learning and artificial intelligence, as we speak, there's a very interesting terminology called as phygital, where there is a human interface along with digital. And I think that's going to be the buzzword in cancer service provision, wherein you cannot entirely eliminate human interface. Now, having said so, having as basic a situation as having your own electronic medical record, going to the data science and machine learning and artificial intelligence is going to govern a lot. And actually, that's where opportunity lies. You can create a lot of innovations there. The lot of impact of AI is actually happening in the field of diagnostics as we speak, predominantly radiology and other diagnostic facilities. But I'm sure service sectors, wherein the human interface currently is very, very strong, would be partially occupied by AI. But again, that human interface would be very, very essential. But what it basically does, it makes your decision more precise, more patient centric, and more personalized, and which at the end of the day, the patient is going to be the beneficiary.
Right. Cancer care is discussed, heavily in medicinal circles. But, however, this discussion mostly happens around tertiary care hospitals, right? How do you see cancer care outside of tertiary care hospitals creating a real impact in cancer treatment?
So that's exactly Emosi wishes to do, and partly we've been successful in doing so. The daycare oncology, medical oncology advisory, and cancer need not necessarily have to be in the confines of a so-called ivory towers of the world. It needs to be with the community. It needs to be in the lanes and bylanes of the cities and towns of India. And that's what the MOC wishes to do. Because as I had reiterated here, cancer has been pushed into a chronic disease. And believe me, patients do not like to go to the hospitals. Patients like to go to these small bespoke units, which are much more proximal, much more personalized, and patient gets the homely touch. Of course, to add to it, because of the low capex asset light model that we've got, we can be a cost leader. So the cost leadership again is a very, very important component, because the way the cancer treatment is evolving, creating a sustainable cancer care model which is plural is going to be very, very essential. And the small daycare units like MOC precisely wishes to do that, and we've been partly successful in doing so.
Any recent examples where, community cancer care has really made a difference? Any past examples you can?
So to be very honest, in for example, city of Mumbai, the way the MOC has kind of promulgated itself, the message of cancer care delivery is equivalent to MOC. That has really created a massive impact. There has been network of a different scale which has been created, and probably out of bigger hospitals, probably we are one of the largest cancer care delivery provider in terms of almost 5.5 like lives touched in last 5.5 years, and almost 75 to 80,000 chemotherapy delivered every year. I think that's the impact that we've been able to create. And yes, it's exciting times.
Dr. Joshi, this conversation has been really insightful and a pleasure to be a part of.
Thank you
Thank you
so
so
much.
much.
Thank you.